In this video, we're going to go through palpation of the cervical spine and let you know what you're feeling for and why. So the first thing we're going to palpate is the occiput, which is the largest bony protuberance that you can feel at the back of the head. Then if we slide down off the occiput into a ridge, the first spinous process that you will feel as you come down centrally is a C2. And we can then palpate down the neck, C3, 4, 5, 6, and 7. When we get to C7, it's the biggest bony prominence centrally in the neck. And if you palpate C6 and C7 together and then ask the patient to extend their head upwards, you will feel C6 disappear under your fingers while C7 stays prominent. Then if we come back up, you can palpate the facet joints, which are located approximately 2 centimeters laterally to the spinous process. Again, you go to the spinous process, come out laterally, and then you can move down from C2 down towards C7. We can also palpate the paraspinal muscles down the neck. We can palpate through the sternocleidomastoid muscles and suboccipital muscles. And we can palpate the levator scapula, which is found if you find the superior medial border of the scapula. And this is where the levator scapula originates from and then moves up towards C2. So you can palpate the origin of that muscle, which is often sore, and then palpate up towards the neck through the muscle belly as well. You can palpate the rhomboids, which are medial to the border of the scapula, laterally to the spine, and you can also palpate the upper fibers of trapezius, which is just superior to the clavicle, both sides. With all of this palpation, you're looking for swelling, pain, lumps, bumps, essentially any abnormalities other than what you would normally feel. The mastoid process is found just behind the ear, and then if you come down anterior and inferior to this, you will palpate a transverse processes, which are the most prominent bony prominence laterally in the neck. If you move caudally and follow a lordotic path due to the lordosis of the cervical spine, then you will feel the rest of the transverse processes. You can also feel the lymph nodes when swollen, and these will lie along the line of the sternocleidomastoid muscle. So if you palpate along here and you feel lumps and bumps, and this could be the lymph nodes being swollen. Also, we can find the carotid artery, which can be found between the sternocleidomastoid muscle and the trachea. And this is really important in patients with hypertension. And if you're considering manipulations with patients with cardiovascular issues, you would want to make sure you do this before you do that, because this would be a contraindication if they had issues in the carotid artery. We can also palpate the temporomandibular joint, which is anterior and inferior to the ear at the angle of the mandible level with C2. Compare both sides for pain, and if one side is more painful than the other, you may want to look at range of motion of the jaw to see whether there's any restrictions here, especially if it relates to the side of pathology that your patient is dealing with. Anteriorly, we can come onto the hyoid bone, and if we come laterally from this, we can feel for the thyroid gland and whether this thyroid gland is swollen. Then we can come onto the acromioclavicular joint, which is lateral to the clavicle. So if you come along the clavicle to the lateral border, you will feel the acromion process. And then if you come into the supraclavicular fossa, you'll be able to feel for the supraspinatus muscle. Also, we can feel the sternocleidomastoid anteriorly as well. And we can palpate the manubrium sternum, and also move from the manubrium sternum laterally to the ribs, and then we can move down from ribs 1, 2, and following on from that downwards. Obviously, with female patients, you want to be aware of how low you're palpating through this, and make sure that it's relevant to their symptoms. If you're a physio or therapist looking to get better, then press the subscribe button, click the bell icon, and that way you'll see all our current videos that are coming out, and they're all designed around helping you to get better. Guys, if you enjoyed this video, then click this one here because you are going to love it.